Hi, I'm Taylor Ferris, and I'm going to walk you through the muscles of the face and neck, their origins, insertions, and their actions, along with the facial expressions they contribute to. So this is Bartholomew, and he's going to help us demonstrate the muscles of the face and neck. Over here, we have the epicranius, or the cranium muscles. You have the frontalis muscle, the galea aponeurotica, and the occipitalis muscle, which would be back here. The frontalis muscle originates at the galea aponeurotica, and its insertion is the skin of the eyebrows and the root of the nose. The action of the frontalis muscle is to raise the eyebrows, which gives it the nickname the muscle of surprise. The galea aponeurotica, galea meaning helmet, is not a muscle, but a flat membrane of fibrous connective tissue which connects the anterior belly to the posterior belly. It also serves as the insertion for the occipitalis muscle, and its origin is the occipital and temporal bones. The action of the occipitalis muscle is to stabilize the frontalis muscle by pulling on the galea aponeurotica. The temporalis muscle is located bilaterally on the cranium. It is a radiating muscle, meaning the muscle fibers extend outward from a central point, giving it a ray of light effect. It covers the temporal bone, and its origin is the temporal fossa, with the insertion being the coronoid process of the mandible, which anchors the temporalis muscle. The action of this muscle is to open and close the mouth for chewing, and it is the core muscle of mastication. The masseter covers the ramus of the mandible, and its origin is the zygomatic arch and bone. This muscle helps with chewing and mastication as well. Next, the orbicularis oculi is a sphincter muscle that surrounds an orifice or the eye socket. The orbicularis oculi is a muscle that originates at the frontal and maxillary bones, with the eyelid as its insertion. The levator palpebrae superioris, or the eyelid muscle, is an antagonistic muscle to the orbicularis oculi because it opens the eyelid, whereas the orbicularis oculi helps with blinking, squinting, or drawing the eyebrows inferiorly, or closing. The orbicularis oculi muscle, however, does have a synergistic muscle, the corrugator, or the wrinkle or frowning muscle, and it is located right above the nasal bone and draws the eyebrows inferiorly. Its origin is the arch of the frontal bone, and its insertion is the skin of the eyebrow. Previously mentioned, the levator palpebrae superioris, or the eyelid muscle, inserts in the eyelid and originates in the eye socket. There is one more muscle of the face that is synergistic, the procuris muscle, procuris meaning long and stretched out. It works with the corrugator and the orbicularis oculi muscles to draw the eyebrows downward to frown. Its insertion is the forehead, and its origin is the skin of the nose. There is another sphincter muscle on the face, which is the orbicularis oris muscle that surrounds the mouth. It draws the lips inward in a pursing and protruding motion for the lips, like if you were to drink out of a straw. Its origin is the mandible and maxilla, or the jaw bones, and its insertion is at the corners of the mouth. It's also known as the puckering muscle. Most muscles of the face are bilateral, meaning there are two that mirror each other on the left and right sides of the body, beginning medially, or closest to the center of the face, with the levator labii superioris nasal alicu. This muscle originates at the frontal process of the maxilla jawbone and inserts in the skin of the nostril wings and upper lip. This muscle flares the nostril orifices outward and elevates the upper lip. Next, the levator labii superioris, lateral to the levator labii superioris alicu nasa, originates at the zygomatic bone and the maxilla bone, and inserts at the skin of the upper lip, meaning this muscle separates the upper lip from the bottom. Laterally to the levator labii superioris are the zygomatic muscles. Both the zygomatic minor and the zygomatic major muscles' origins are at the zygomatic bone or the cheekbone, and their insertions are the skin and muscles of the corner of the mouth. What differentiates the two is that the zygomatic minor is the smiling muscle and the zygomatic major is the laughing muscle, meaning both muscles raise the corner of the mouth. You then have the levator anguli oris muscle, levator meaning lift, anguli meaning corner, and oris meaning mouth. This muscle lifts the corner of the mouth. The origin is the anterior surface of the maxilla bone, and its insertion is the corner of the mouth. If you try sucking in your cheeks, the muscle responsible for that action is the buccinator muscle, otherwise known as the trumpeter's muscle. This muscle compresses the cheek like a trumpeter would, and it also helps with whistling. Its insertion is the orbicularis oris muscle, and its origin is the molar region of the maxilla and mandible. The buccinator lies deep to the masseter muscle. The risurus muscle, risurus meaning smiling or laughing, is a muscle located superficially to the masseter muscle, and its insertion is the skin and angle of the mouth. Its origin is the deep fascia of the face, meaning it envelopes and binds the muscles of the mouth, and its action retracts the angles of the mouth for smiling and laughing. The depressor anguli oris does exactly what the name says. Depressor meaning down, anguli meaning corner, and oris meaning mouth. So this muscle pulls the corner of the mouth downward. The origin of the depressor anguli oris is the outer surface of the mandible, and its insertion is the angle of the mouth. The depressor labii inferioris, you guessed it, pulls the bottom lip downward and draws it laterally. Its origin is also the outer surface of the mandible, but its insertion is the skin of the lower lip. Lastly, of the facial muscles is the mentalis. This is a V-shaped chin muscle whose origin is below the incisor teeth of the mandible, and its insertion is the skin of the chin. Its action wrinkles the chin and protrudes the bottom lip out in a pouting motion. There are two muscles of the neck, the platysma and the sternocleidomastoid. The platysma is a superficial muscle that is anterior to the sternocleidomastoid, or SCM, and its origin is the fascia of the pectoral and deltoid muscles. The insertion of the platysma is the lower edge of the mandible and the skin at the corner of the mouth, with the action pulling the lower lip back and down, and also tenses the skin of the neck. The SCM, or sternocleidomastoid, sterno meaning breastbone, cleido meaning clavicle, and mastoid relating to the mastoid process. This muscle is a two-headed muscle that runs deep to the platysma and originates at the manubrium, or the head of the sternum, in the medial portion of the clavicle. Its insertion is the mastoid process of the temporal bone and the nuchal line of the occipital bone. This muscle pulls the chin in the direction of the chest. And that ends the video on all the muscles of the face and neck, their origins, insertions, actions, and expressions. Thank you for watching.